So I'll be talking about comparison of retinal imaging with Heidelberg and Optos versus what are the advantages and disadvantages. So first of the multimodal imaging is the color fundus photography. Now, as has been, you have seen these beautiful images of the Optos. There is no comparison to the Optos technology and Heidelberg as far as color imaging is concerned. Especially if the lesions are peripheral, they are elevated, you cannot have any other system like Optos to capture the wide field imaging of the color fundus. If you have hemorrhage, you have panoramic view of the fundus incomparable with the Optos. Documentation is extremely useful with the Optos. You can't compare with any other technology. But it can miss some findings in the periphery. So indirect ophthalmoscopy with scleral indentation remains the most reliable. But if you want a panoramic view of the fundus examination in an undilated pupil or in an uncooperative patient, so this is the technology for you. You can see the entire fundus without dilating the pupil. So it is extremely useful for screening the patients and documenting your findings of the peripheral fundus. It's the greatest tool available. So now color imaging, fundus color imaging with the Heidelberg Spectralis. So basically this machine comes with three lenses. One is a 30-degree lens, basically meant for the posterior pole, 55-degree lens which is going up to the equator, and you have got an ultra wide field lens that is 102 degrees. So the color imaging is possible only with the 30 and 55. With the ultra wide field 102 imaging, it is not possible. So this is the 55-degree image. Because of this laser technology, you get very accurate representation of the undulations in the surface of the retina. So you can see very finely all the changes, but they are not very great, the 55-degree color images. So what is the technology of multicolor imaging? It comes in its element basically with the 30-degree lens, central lens. So very fine macular changes are documented and highlighted so fantastically with this multicolor imaging that very fine things you can pick up with this 30-degree lens multicolor imaging. So I will show you this particular image with the multicolor central. You can see every striation seen at the macula, whereas it's not very great with the Optos. There is some loss of resolution for the macular imaging compared to the 30-degree multicolor imaging. So then some very subtle changes which can be there. Now this is a case of parafoveal telangiectasia. Even the naked eye cannot pick up these very subtle findings in the early stages. In the advanced stages, obviously you will see the classical perifoveal halo and other things. So this is a early stage of parafoveal telangiectasia, and you can see the multicolor imaging picks up this perifoveal gray. It will tell you that there is definitely something abnormal. You correlate with other multimodal imaging technique like OCT, you will not miss the diagnosis. The same patient seen on a Optos, because it is basically designed to get a panoramic view of the fundus, you can miss very minor details of the macula. Not in every case, but in some of the cases you may not. Now other thing is in a dense, if you have a cataract, so in a cataract the macular imaging with the multicolor of the Heidelberg Spectralis is amazing. So you can see, you cannot see much with the Optos image, but with the multicolor image you can see all the fine wrinkling appearance of the macula in the posterior pole scan, and this is corroborated with the OCT. You can see very fine, everything can be seen, every detail undulation of the retina can be seen in the posterior pole. This is a case of dissociated optic nerve fiber layer, where it is very easily documented with the multicolor imaging, whereas these details cannot be that properly highlighted with the Optos imaging. So basically very fine details of the posterior pole, you can have some additional advantages with the multicolor imaging of the posterior pole. Is another example of a suspected disc edema. Even with the naked eye, it was a bit difficult to know whether their disc was really elevated or no. So you can see with the optos image of the same patient, you can see something, but you don't know whether the disc is a normal variation or it is abnormal. But with the multicolor imaging, you can see that the bottom, compare it with the normal fellow eye, you can see it's highlighted so well, you know that there is a disc edema that you cannot pick up even with the naked eye. So as far as the posterior pole imaging, the multicolor imaging has got some advantages over the other technologies. But I would say that the same image with the traditional color fundus photograph and the optos image, you can see side by side the finest imaging details of the fundus of the posterior pole are still the best with the traditional fundus camera. So still it remains a gold standard for posterior pole imaging, the traditional fundus camera. Now we have to give printouts to the patient, and again this Heidelberg technology, especially if you want to give some pathologies of the macula and other things, you give very wonderful printouts, and you can highlight all the pathologies very nicely. So you can see this case of macular BRVO. You can see the very nice imaging of the posterior pole, and the combination with the OCT printout looks very nice. And this is a heredomacular degeneration on the right side. Again, you can see very nice area of the central atrophy, the autofluorescence which is there side by side, and the OCT image. So to give the printout of the patient, they look very nice, and you are able to give what you have documented on your fundus imaging system even to the patient as a printout. Otherwise, many technologies, they look very good on the computer, but you cannot give good quality printouts to the patient. So with this, the additional advantage is that the quality of the printouts are really good. So as compared to the optos, not great quality of printouts, but they are decent but not great. Now some additional features are there with the Heidelberg technology, which is the infrared imaging. So some of the pathologies like the retinoschisis or some pathologies in the mid-peripheral fundus are highlighted very nicely with the infrared imaging because of the laser technology. This kind of imaging is very accurate. So for follow-up of the progression of the schisis and some of the peripheral lesions, even though it is a black and white image, you can have a very nice detailed view of this and follow up in the periphery. Now this infrared imaging is very useful even for the OCT, because the kind of printout which you can, the kind of image which you have of the infrared fundus, you can have very accurate documentation from where the scan is passing through the fundus. So this is a very important addition to the OCT technology, the infrared imaging of the fundus. Now coming to autofluorescence imaging, comparison between the Heidelberg and the Optos, there is no comparison for wide field autofluorescence because the spectralis is not designed for wide field autofluorescence imaging. So where you want wide field autofluorescence imaging, Optos, there is no comparison. It does fantastic. But when you come to the posterior pole again, to document very fine details, again it is a slightly superior to the optos imaging because of the blue pleaked autofluorescence. So it makes the hypoautofluorescent lesions and the hyperautofluorescent regions much more contrast. So it is a gold standard for imaging for dry AMD and geographic atrophy, especially in clinical trials. We have got many technologies coming for the treatment of dry AMD. So for posterior pole autofluorescence imaging, the spectralis Heidelberg has got some edge. So this, you can see a progression of the geographic atrophy very highly highlighted. Now the next technology which we compare, modality which we compare, is the fluorescein ICG angiography, Heidelberg versus Aptos. Now basically the Optos, definitely on the right side you can see it gives a very wide imaging of the fundus compared to the Heidelberg technology. But with the 102 degrees lens which you have with the Heidelberg, you get better superior and inferior quadrant, that is a vertical meridians you can see wider than the Optos because of the lashes and the eyelids. The imaging with the in the superior and inferior quadrants is slightly wider, and whatever picture you get is slightly better quality than the optos. Now there is no comparison for the single shot image of a fluorescein or a ICG angiogram with the optos. With a single shot, you can see a very panoramic view, and you can highlight the pathology in each phase, entirely what is happening through the entire fundus. That's the strength of this technology, optos. But you can do some adjustments with your Heidelberg machine. There is something called as steering. So you ask the patient to slightly move the eye, and because this machine can be swiveled, it allows you to capture very beautiful images even of the periphery. Obviously you will not reach the aura, but you can have quite anterior views. So you can see a comparison, a single shot view with the optos and a steered Heidelberg image. You are able to capture all the details what the optos is imaging. So this is the case of PHCR, peripheral exudative hemorrhagic choroidopathy, and this is a ICG angiogram steered view with the Heidelberg. You can see all the polyps, and you will not miss any findings even with the Heidelberg with the steered images, beautiful images. So this is a case of vasculitis. Again, you can see with the steered image, you are able to capture the peripheral fluorescent angiographic features of the fundus very nicely, and it is as good as the optos, only you have to have steered images, not a single shot straight ahead image. So the next modality which we want to compare is the OCT, Heidelberg versus optos. Now at the outset, the OCTA technology is still not available, but it will be available in the optos. So but right now the OCTA technology is not available. But the advantage with the optos technology for the OCT is that anywhere in the fundus you can take your cursor and view the OCT sections of any part of the fundus. That's a very huge advantage. May not relevant for day-to-day practice that much, but for research and other purposes it's extremely useful. So if you can see the optos OCT going to the periphery, the schisis has been, you can take a section of the OCT anywhere you want and document the vitreoretinal interface findings. In the periphery of the fundus, distinction between a hole or a cyst and such things can be advantageous even for the clinical scenario. So this kind of imaging is not possible with any other technology, only with the optos. But where the Heidelberg OCT scores is that the kind of reliability which it can give you with the combination of manual joystick operated steered images, ability to move the fundus camera, so it gives you some special advantages, and complemented that with the live tracking. And because of the live tracking, very reliable serial comparison of the same images of the same patients over time, which is extremely important, especially in wet AMD, glaucoma, all those things. The serial comparison of the each image and documentation because of the live tracking is extremely important. Because it is so accurate, there is a documentation of the vascular pattern of the fundus of the patient, and that will be compared and with the every time. So you will have the same scan at the same point of each time. Then it is unmatched reliability and resolution for retina and glaucoma scans. So you have got a very good normative database, you have excellent glaucoma premium modules and other things. So it makes a very reliable technology for your routine OCT technology. Then Octa, as I said, is not available with the yet available with the optos, and obviously anterior segment imaging is also not yet available with the optos. Whereas in the Heidelberg, you can do the cornea imaging, the angle imaging, all these things can be done even with the Heidelberg. So some advantages like OCTA and anterior segment imaging with the OCT is possible, but not possible as of now with the optos technology. Both technologies are extremely excellent, but you should know some limitations will be there for each technology, and there are strengths of each technology, and they have to be put in perspective and utilized in that particular way. So optos is unmatched for multimodal ultra wide field imaging. Anything you go in the peripheral fundus, there is no technology which can give you a multimodal imaging with that accuracy and quality. So, and but it doesn't have the OCT as that, and very minute macular pathology can be missed sometimes with the optos because it is designed for a panoramic view of the fundus. The spectralis is also a very wonderful multimodal imaging, but color photography is absent. So you will need a color imaging device because there is no color fundus imaging. Multicolor imaging is available. It has got advantages which I have highlighted in the presentation. But if you ask what should we go, and most of us will be already having a traditional fundus camera, and it still retains its place in the armamentarium of a retinal surgeon for the multimodal imaging, and the traditional fundus camera still is very useful for posterior pole and traditional 100-degree imaging. So you don't throw your fundus camera out. You can, if you combine the Optos Daytona for color imaging, autofluorescence, Spectralis for wonderful OCT and angiographic images, and the traditional fundus camera for good color fundus photography, it makes a complete multimodal imaging system for your clinic, because you're not relying only on one machine. If one machine breaks down, you have something to rely on. If you put all eggs in one basket, if one machine breaks down, then you can have problems. Thank you.